In this video, we'll discuss about amoxicillin, how it works, use, dose, side effects, contraindications. How does amoxicillin work? It is an antibiotic of the class of beta-lactam antimicrobials. It acts by inhibiting the synthesis of bacterial cell wall. Amoxicillin is a penicillin-type antibiotic belonging to the penicillin family. Uses are to treat a wide variety of bacterial infections such as tonsillitis, bronchitis, pneumonia, and infections of the ear, nose, throat, skin, or urinary tract. In combination with other medications such as clarithromycin and lansoprazole, it is used to treat stomach ulcers caused by Helicobacter pylori infection. As for the dose of amoxicillin, it varies according to the severity, age, and the type of infection. It is better to consume it exactly as prescribed by your doctor in the same duration and dose. Skipping your doses can increase your risk of infection that is resistant to the medication. It is contraindicated in patients who are allergic to penicillin, patients with mononucleosis, liver problems. Side effects are stomach pain, diarrhea, rash. If you're having severe signs of allergic reaction to amoxicillin, get emergency medical help. Some quick tips. Antibiotic medicines can cause diarrhea, which may be a sign of a new infection. If you have diarrhea that is watery or bloody, call your doctor before using anti-diarrhea medicine. Take amoxicillin exactly as prescribed by your doctor and at the same time each day. Use this medicine for the full prescribed length of time even if your symptoms quickly improve. And that's all for this video.